Welcome everyone who's joining us this morning. We're just going to let everyone give everyone a few minutes to kind of log in and get signed into Zoom, and then we'll get started just in another minute or two.
Hi, everyone. Thanks so much for joining. We're going to give it another minute or so just to make sure that people can join. But we're excited to have you here and to get started soon. Hello and welcome. Thanks so much for joining us today. My name is Kathy Vaughn. I am the Director of Learning, Innovation, and Research for CASA, the Climate Adaptation Support Activity. I'm joined here in the webinar with our comms manager, CASA's comms manager, which is Hannah Blair, and you'll see Hannah adding some notes to the chat as we go through. I wanted to start by quickly talking a little bit about what this webinar will cover. And then I guess I'll go through after some housekeeping items, I will turn things over to Dr. Mai Hijazi from USAID in order to give us some opening remarks. Then we've got some great presentations from Barbara Platzer, Dr. Ousmane Ndiaye, and Dr. Joy Shumake, who will give us an overview. So we'll introduce some materials that we've developed, CASA's developed, and look into some case studies, and then give an overview of the climate and health landscape, focusing, of course, on climate information services for health system strengthening. Near the end of the webinar, we're going to save about 15 or so minutes for questions and answers. So we're going to ask you please to keep your questions in mind and pass them along. And then we'll pass it to Kristen Patterson from USAID for some closing remarks. So just a few housekeeping items before we get started. First of all, this session is being recorded. And the recording will be shared with everyone who's registered. I also want to say that the information that is shared in this webinar and through the materials that we're presenting don't necessarily reflect the views of USAID or the United States government. And then finally, as I said, we're really looking forward to questions from you and to have some interaction. So please ask your questions through the Q&A function, as it's pointed out here. Okay, with that, I also want to take this opportunity to talk a little bit about CASA itself. So CASA is the Climate Adaptation Support Activity. We are a 5-year project. We're about 2 years in right now. So we've got plenty of time left, and we're working on designing activities and thinking about strategic support for missions, operating units, and bureaus to advance effective adaptation mainstreaming and to scale meaningful change around adaptation. If you want to know more about CASA, you can feel free to visit our Climate Links page, register for our newsletter, or also reach out to the contacts who are listed here. Okay, with that, I'm going to turn it over to Dr. Hijazi, who is the Director of the Office of Health Systems in the Bureau for Global Health at USAID. She has a wealth of experience on this topic and has worked at USAID in the health sphere since 1997. So we're really pleased to have her here and to get her perspective both on the Health Systems Learning Series and on the use of data for decision-making in the health space. Thank you.
Great. Thank you. Thank you, Kathy, for the introduction and welcome. And also welcome to our esteemed speakers and audience members. Thank you for joining this month's Health System Strengthening Learning Series event. USAID hosts the Health System Strengthening Learning Series to share, learn, and use HSS evidence for more effective and sustainable health system strengthening. The field of HSS and USAID's work continues to evolve, making this a much-needed opportunity to reflect on emerging needs for new evidence, current priorities, and new strategic directions. HSS Learning Series events are designed to generate and synthesize knowledge related to USAID's 6 learning agenda questions and to exchange insights on the greatest needs in the field of HSS. You can now find the Learning Series key takeaways and resources on USAID's public website at usaid.gov. Climate variability and change are more than environmental issues. They cause devastating impacts on human health, nutrition and food security, ecosystems and biodiversity, peace and stability, and equitable access to essential health services. Globally, we have observed that infectious disease outbreaks and epidemics have increased in tandem with global temperature rise since the early 2000s. The climate crisis is driving increases in maternal and child malnutrition, which contributes to almost half of child deaths. And it exacerbates social and gender inequalities, increases vulnerability among marginalized populations, and puts extra stress on our health systems. Resources like clean air, safe drinking water, and food security are increasingly compromised, while the health sector also faces mounting challenges and costs from extreme heat, floods, wildfires, and storms. These events disrupt healthcare delivery, exacerbate disease patterns, and also contribute to a surge in climate-related illnesses. Resilient health systems are the first line of defense to protect communities from the health impacts of climate change. Health systems are resilient when they effectively integrate and implement climate adaptation policies to protect population health from climate stressors, ensuring access both to quality and equity healthcare for all. When people seek help, also primary healthcare will often serve as the first point of contact for individuals, providing an opportunity for detecting and managing climate-driven health issues, promoting community resilience through education and preparedness, and also ensuring access to essential healthcare services before, during, and after extreme weather events. More specifically, strengthened primary healthcare services can support adaptation strategies to climate extremes to protect the health of populations, specifically for the most vulnerable. Data-driven decision-making is one way to enable the climate resiliency of health systems. And it does this by providing the guidance to adjust resources, policies, and focus to respond to climate-induced health challenges and ensure that the responses meet the needs of the population in all disease areas and aspects of their healthcare. Today's event will dig deep into USAID's Climate Adaptation Support Activity, CASA, which provides strategic support to USAID programs and partners to help partner countries fully incorporate climate change adaptation into their planning, programming, and work. I'm really looking forward to hearing from our colleagues who will dive deeper into the role that climate information services can play in supporting health systems and health-related programming in the face of climate change. Thank you very much, and Barbara, over to you.
Thanks so much, Dr. Hijazi, and thanks so much for those important scene-setting remarks. Let me just say how thrilled I am to be with you today. It's been quite a journey in the climate and health space, and we are really fundamentally in an entirely different landscape than we were a decade ago, and even just a year ago. So much is shifting right now. And so we've been really excited to document these mountains of evidence and see so much more investment and appetite coming into the climate and health space. There's really a tsunami of demand brewing, in particular for better data and better tools, and to support climate-informed health decision-making and health system strengthening. And this presentation briefly summarizes some new resources developed by myself and my amazing colleagues, Paula and Charlotte, if you're off on camera, give a brief wave, who led a lot on these deliverables. And a shout out to my wider CASA team as well, and support from the Bureau for Global Health and the Bureau for Resilience, Environment, and Food Security. Next slide, please. Under this recent effort, the team at CASA has been invested in particular in developing 3 new resources to support USAID staff in deploying and better understanding the potential for tailored climate health services. And these include a technical report, and this was really intended to serve as a primer, showcasing first movers and recommendations and signposting key resources, as well as outstanding challenges and some critical lessons learned. There's a series of case studies, which I had the pleasure of rereading this morning, and they're really such a tribute to the pathbreakers and colleagues that have been on the front lines of this work over the last few years. And lastly, we also developed some learning materials intended to really to be self-paced and pragmatic for additional orientation in this space. A quick word on how all this exists and relates to existing USAID strategy, both in terms of your evolving health system strengthening approaches and your climate strategy. And I know Kristen Patterson at the end will voice some of this as well. But as we heard from Mai, resilient health systems are really the first line of defense to protecting communities from the health impacts of climate change. And information services, or CIS, can serve as critical tools to achieving better health outcomes, but also really to supporting those core building blocks of health strengthening. For example, CIS can safeguard and improve the quality of health service delivery, helping anticipate climate threats, manage risks, and ensure that care infrastructure is climate resilient. And they can optimize resources by using data for better decision-making and efficient allocation of funds and personnel, contributing to those core funding blocks of financing and people and information. These are just some illustrative examples. And the materials in the technical report and in the case study will delve more into how this connects to existing strategy. But the point here, I think, is just generally that climate information and integrating climate information services does not have to mean reinventing the wheel. It really means leveraging and ensuring you're building on your existing frameworks and strategies. So the technical report, we tried really hard for this to be a primer, and I've referred to this informally, some of you and I'm in touch with, as my love letter to the field, having toiled away over the last 15 or 20 years in the trenches of climate and health, working alongside some really incredible leaders and experts, some of us joining on the call today. And it's really meant to be a practical guide to get bearings in the space with some caution signs and some signposting to what's out there in terms of best practices and great resources. It covers opportunities and challenges and also makes pragmatic recommendations for USAID teams to consider when integrating climate information into health planning. A few highlights and sort of some key takeaways are included here on the right, which I'll just voice over now. So while there's an abundance of evidence there is really no one-stop shop for climate information services. And this is an important point, and I think it's been tried, but it's important to understand just how much is out there in terms of breadth and resources, but also how much noise is out there. Resources need to be vetted and fit for purpose and relevant for decision makers on the ground. There are many windows of opportunity, not just around forecasted information, and many different timescales of information to leverage. So these include early warning and risk management tools for targeted interventions, routine monitoring and surveillance and planning tools, as well as impact and vulnerability assessments. The fourth point here is climate information services are tools, and they need to be deployed through trusted partnerships. My line on this is often the technology alone won't save us. And it's really important to understand that these tools are deployed often in very complex ecosystems, and you need to broker trust at every stage of the process, both in terms of impacted communities, but also those that are designing the tools and integrating the tools. Lastly, next generation climate health services require core investments in policy coordination and governance, and those are sometimes really tough nuts to crack. Capacity building, communication and dissemination, and operational services and integration. Next slide. While there is currently no one-stop shop for climate information services, the technical report provides an overview of the wealth and breadth of available resources that can be considered when developing and also evaluating and improving your interventions for future investments. Examples for these are included in the report, so I won't go into details here. But just to say, there are also recommendations on their fit for purpose use there as well. And it's really critical to understand what's out there and drill down on what, say, a global product offers you versus a national product or a bespoke tailored research tool. And I'll just say, just a quick note here, over the last decade, we've seen a 6-fold increase in climate and health research. So there really is a lot out there to leverage. Next slide, please. I'll also just add quickly a note of caution on climate information services, and they can really act as critical tools to leverage, but we know that they themselves don't guarantee impact. And so it's worth acknowledging that despite growing awareness of climate impacts on health, the integration of climate information services into health decision-making is largely underpowered still in the health sector. There is significant untapped potential for CIS and health system strengthening. And here on the slide, there's just some outstanding areas for investment. I won't go into them in detail because they're covered in a bit. But just to reiterate, we really have to be mindful of the challenges head on and address them. So also, in addition to the explosion of evidence, there's also really excellent documentation out there of what we know works well. CIS grounded largely in co-creation with impacted communities and with experts in data science and health modeling and climate modeling and ethicists. And we've heard pleas also to incorporate big tech, but there are really lots of documented practices out there that are important to build on and piggyback on. One of these here featured here is a figure developed by Joy and colleagues from the WHO WMO expert working group that articulates best practices for implementing integrated climate, environment, and health science and service data. And the report expands on these and other examples of best practices. Next slide, please. So that covers a bit of the technical report. The next resource I wanted to highlight here is a series of case studies we developed. We initially sourced 20 amazing stories, pitched 10, and agreed on 4 against the selection criteria included here. And what's clear, I think, here is that there's an abundance of really exciting work happening on the ground. We no longer really have to demonstrate the proof of concept or even always make the case for investment. We know there are valuable tools that are working. And what we need to do now is really level up and inform systems level strengthening. In developing the case studies, I should add, we learned about things that were pioneering, but not necessarily path-breaking in the case of the PEPFAR El Nino distribution of funds to WFP. And we also heard quite strongly from the USAID community that current financial infrastructure and flows are not set up to promote integration and holistic approaches. Next slide, please. So the case studies provided an overview of 4 distinct examples of climate information services for health system strengthening, and we've included in each of the cases information on background and approach and lessons learned and key recommendations. And I will just voice over some honest takeaways from colleagues that we heard firsthand around these details, around these cases. So just a few key points summarized here. In the case of the PEPFAR El Nino response, lessons from food security and HIV/AIDS crisis funding, we heard about this being a pioneering case for USAID, but not necessarily a path-breaking one. This built on sort of the story of an integrated financing mechanism. PEPFAR distributed $25 million to WFP for El Nino response to tackle severe and moderate malnutrition in HIV populations. And it was really led by champions on the ground, USAID health officers and country missions, a senior nutrition advisor that was called out for being a real champion on this, as well as several US ambassadors who raised the alarm on the need for emergency food assistance targeting HIV populations. And so sometimes it's just 1 or 2 people on the ground who can really move things. And I think that's heartening and important to take note of. But it was reiterated that that unlocking of integrating financing was a one-time disbursement. And that's something that we heard in a lot of our interviews with USAID country missions, that more work needs to be done in terms of not just earmarking funds, but having really integrative and adaptive financing. The next case was on health early warning system to reduce extreme heat impacts in Senegal. And we're lucky to have Ousmane on the call with us today. He'll delve further into this example. But what I will say about this case, what was really noteworthy and exciting was this excellent demonstration of localized approaches to communications and engagement of stakeholders. Everything from working with fire brigades and women's groups and Red Cross chapters and sports authorities, as well as really securing and brokering the buy-in from the local governor and governing authorities. So it really underscored how important it is not just to develop this cutting-edge climate information and climate information tools, but how much you have to partner with strong community approaches and groups that are already integrated, both in terms of not just the information dissemination, but really in the co-creation and consultation processes. Next slide. So next we had the case of the epidemia tool in Ethiopia that supports climate-informed early warning and response systems for malaria. And in this example, we learned of country efforts that have benefited from really strong national leadership on climate health. I think many of you know that the current DG for WHO is former Minister of Health from Ethiopia. And so we heard this from folks on the ground, that there is a real national understanding on the complex relationships between climate and health, and a really long track record to leverage. But while we also heard about the national leadership and some really interesting scaling up of this pilot project, we also heard that even when people are committed to climate information services and health system strengthening, there can be this perceived trade-off and competition between funding for immediate life-saving medicines and health delivery versus investing in front-loading information in climate information services. And this was sort of hammered home by the exceptional Huat from the country PMI office, and sort of a gut-checking quote in the case study. So the case for investment in climate information services still sometimes needs to be made so that these pilot efforts can be sustained, scaled, and proved valuable over the long run. And lastly, we also had an example from real first movers in this space. The IFRC Climate Center and Red Crescent chapters are generally acknowledged to be ahead of the pack on some of this work, and are often pioneering in terms of climate information services at scale, both at the global, regional, national, and subnational levels. And they're really committed to this in terms of implementation and operations and financial flows. A key message we heard from partners here was to not let the perfect be the enemy of the good, to learn from mistakes, and to not wait for data and tools and programs to be perfect before taking action, because the need and the urgency is there. Next slide, please. So the last resource that's soon to be published, I believe it's going up shortly after the webinar, are these learning materials that we designed to be self-paced and self-guided. And they cover 5 modules intended to really provide some pragmatic and upskilling in this area. To give you a quick preview and some practical applications, I'm also just going to provide really quickly some highlighted examples of how these tools are already being deployed as part of the USAID portfolio. And I'll just profile some of these, but I realize I'm going over on time. Next slide. Can we advance the slides, please? Thanks. So in terms of, so we previously talked about early warning for emergent health risks, so risk management tools for better targeting interventions, routine data for medium to long-term planning, and the use of climate impact assessments. I just wanted to highlight some really exciting tools that are already being leveraged. So the first here is the Early Warnings for All project, which is a multi-hazard tool that really supports the disaster risk preparedness community and is supported under Prepare, USAID, USAID, WMO, NOAA, and other partners. Another practical example of early warning, next slide, please, is the African Cholera Risk Early Warning System, ACRUS, that leverages both observed data and satellite data for monitoring outlook and forecasts. In terms of other applications, I also wanted to profile risk management for better targeting of interventions. Next slide. And for this, I wanted to profile the work that the MDive tool is promoting in terms of malaria eradication efforts. And this tool has been used to inform procurement and stocking and distribution of seasonal malaria chemoprevention, targeting under 5-year-olds, largely using satellite information and proxy information to trigger vaccine campaigns and to anticipate when flooding, for instance, might risk health delivery in terms of health facilities being disrupted. Next slide is a tool that we also wanted to profile in terms of fire tracking. This is a tool developed by NASA Severe and supports anticipation of wildfires in the Amazon. It uses both extreme forecasts and interannual forecasts, and has an integrated El Nino component to it, and also is really a great example of CIS in action. Next slide. In terms of routine integration of data for medium to long-term planning, we wanted to showcase again here epidemia in terms of its capacity for malaria early warning. But what's really exciting here is it's not just around forecasted information, but it's also around better monitoring and surveillance of ongoing outbreaks and planning in terms of national roadmap for malaria early warning systems. And lastly, as an example for how USAID can leverage climate information services for impact assessments, we wanted to profile the work of PMI. And I think this is an important bucket to understand in terms of sometimes the nerves around using forecasted information or integrating climate information mean that people can sometimes hesitate in terms of adopting these, but sometimes one of the really powerful mechanisms to integrate climate information is looking at what the climate has been doing over the past few years and over the past decade. And so for this, I just wanted to highlight the work that PMI has been doing on assessments of interventions in 15 high burden countries. And I know that some of this work is currently in development to scale to additional countries. So that summarizes just in a sort of a rapid clip some of the resources that are available. And these are all available on Climate Links, and it's been a huge privilege to develop these alongside my colleagues Paula and Charlotte, and with amazing contributions from pioneers and friends and new allies on the front lines of climate information services. Before I pass over to Ousmane, I just also wanted to cover 2 additional slides. And one is just to sort of voice that a lot of the remit of this work under CASA is on adaptation, but it's really important that we acknowledge also that adaptation has limits, and that there's really no scenario where health systems can adapt to unmitigated climate change. CIS tools can drive a better understanding of how our changing climate is impacting us all. And this can really inform policy and movement building around climate change, including emerging research on attribution and passionate discussions around loss and damage. And so this is just to say that there's a real need to increasingly move outside the silos of the adaptation and the mitigation agendas. And lastly, before passing along to Ousmane, Fernanda and some of the colleagues at USAID asked me to quickly reflect on where we go from here, next steps, and to capture maybe a bit on how much the ground is really shifting underneath. Last year's COP was a bar-raising moment for climate health, and some of you may be soon packing bags for the next COP in days ahead. I also just wanted to include this image here from a meeting recently held in Geneva by the joint WHO-WMO Office on Integrated Climate and Health Data and Surveillance. And it was the third in-person convening of this group, and the air just really felt different in Geneva. And I think what was clear from that meeting is that there was this ample consensus on the evidence and story after story of heavily brokered and negotiated trusted partnerships driving forward climate information services for health system strengthening. I'm excited to hear Joy's take on this moment, but wanted to close also with this quote from the WMO Deputy Secretary General Co Barrett. Some of you might know her from the Obama administration, so I'll just read this aloud. We are at a unique moment where the convergence of climate science, technology, and public health provides us with unprecedented opportunities. By combining the expertise of the meteorological community with that of the health community, there is tremendous potential to support the most vulnerable. And so it's perhaps worth taking a moment to celebrate just how far we've come on this work, which has been so hard and scrappy for so many years. It's worth noting also that I think last I checked, there were 100+ of you that turned up for this call. And so thank you for participating in this conversation. And this is just one effort on and a step on a longer journey. But thank you so much for taking part in this call. And with that, I'd love to invite Ousmane, that we're lucky to have with us, joining us today, to provide an overview of one of the cases that we developed, as well as to provide some country perspectives. Dr. Ousmane Ndiaye, currently serving as the acting director for meteorology at the National Civil Aviation Authority and Meteorological Agency of Senegal, NSM. Though we understand, Ousmane, there are some big, exciting transitions afoot. Ousmane is a leading expert on climate prediction and its applications. He has partnered extensively for many years with NGOs, researchers, extension workers, and communities on how to impactfully deliver climate information services. And at NSM, and in collaboration with NOAA's Climate Prediction Center, he pioneered a heat health early warning system that leveraged some of these frontier technologies and localized approaches that reached, engaged, and enlisted community members in entrepreneurial and impactful ways. Ousmane, over to you.
Thank you, Barbara. Thanks very much for giving an overview and for the introduction. I'm going to present to you at the national level, how do we implement a heat wave early warning system, and how do we manage to work with the health department to help them get information, and also population as well. As you well know from the last IPCC report, temperature going to be rising and heat wave going to be more frequent and more intense. So we need to do something. But the problem is, as African country, or most of African country, we cannot cope directly with heat wave. Our best approach, our best strategy is anticipation. I mean, getting early warning per se. So here, what I'm showing you in the screen is just the bulletins that we co-developed with the health department in Senegal. What we do is, as a MedSaves, I will come to that, and how do we develop it? I mean, we got the climate forecast. This is available now. There's a lot of model doing climate forecast. So you can have an idea how temperature will be in the coming weeks. So you can have an heat index and then develop a forecasting of a heat wave. That's what you see on the left side of the bulletin. And then you can indicate some color coding, how severe is the heat. And on the rightmost panel, you can see when you include vulnerabilities, because every area will not feel the heat the same way due to lack of some facility, the grades of variabilities, and then you can communicate really where we expect to have more risk, higher risk for these heat waves. So this bulletin is done, as I said, with the health department, and you see on the middle panel, the health department know how it impact, person, the body. He will give some practicals that you can do, like, and what type of person are really, at risk, are vulnerable, like elderly people, pregnant people, children less than 5 years, people having some kind of disease. So when we give them the bulletin, we co-product it, we develop it, and then we disseminate it with different channels. Next slide. So co-production, the way it works is we get the global forecast with NOAA, the American Met Service. We have the global model. So we get it and we compute what we call the heat index, and we detect in the future, 1 to 3 weeks, do you have heat or not? And then in Senegal, we combine it with vulnerabilities on heat, and then we have what called the vulnerability maps. And it's really a co-construction, work. You can see on the left-hand side, on the bottom, you can see the health department. You can see Red Cross that will disseminate it. I will come to that, and the Met Service and the environment. So once we get the bulletin, we disseminate it to all the practitioners, all the hospitals that exist at the district level, so they get this bulletin. It helps them to know that, there is a heat wave coming, so more people will turn in, and they know what kind of disease are related. Those they plan, they do some practical planning, what to do in the next week, due to this forecast. And also Red Cross help us to get some feedback. I mean, the feedback is always built in. Whenever we send an early warning, Red Cross has a volunteer at the local level, so they can give us some feedbacks. What we did last year, November, we did a case because we wanted to know what people are doing with this kind of bulletin and what kind of feedback we get. So we went and do a scale exercise where we sent this kind of early warning through community radio, through text messaging to one district of Senegal. Of course, the government was involved because the local governor knew about it. So when you sent it, people get it, and then after the warning, we went with the Red Cross volunteer to get some feedback. What did people get it? Which channels they get it? What did they do when they get it? How they feel with this heat, and so we have a lot of turnaround. I can just tell few. One is, of course, school, because we are young people working, and we have some student who fainted actually, and we got that from the governor. The government called us and to tell us your early warning was really great, because the firefighter called us many times, says that they was going to pick up few students, they fainted at the school. And then we got also that when the heat is really high, people are not, getting the class right. They don't understand what people are saying because it's very hot. It's very difficult to learn during hot period. Also, there are many outdoor workers, farmers, also shepherds. They go from different places, there are nomads. They go from one place to another place, and they are exposed to heat wave. Also, in Africa, there was many people who do outdoor sports. So they get back to us and tell us, it was really great. They know this early warning because they shift their time of doing sports. So we got a lot of feedback. But the strategy also we work with many local people. I mean, there was some women organization organized by NGO, and then work with them. They usually work with the health community, on birth control. So we use them. We don't reinvent the wheel. So we use them. Trains them and tells them, how it works, and then to get feedback from them. Of course, most of the work was done by Red Cross people. So, and then we got all those feedback, all those survey, and to look at what are the gaps, what we need to do more, and we discuss with people in the evaluation, and then we are trying now to upscale it. This was just an example, just to test and to see that what are the people at stake, what are our people that we should target, and how to develop it. The community radio seems to be very efficient because many people got the information from community radio. Text messaging also was great, and training is needed. People need really to know, because in Africa, where we are in the Sahel, people thought that heat wave is just normal, when it's hot, so what? It's just a normal, things, but it's getting hotter and hotter, and it will grow. So what we really need is the government to put it in this strategic plan, to ensure that the way they build hospitals, the way until they store drug, because we got feedback that even storing drug in the heat, it's a problem. The school, as I said, avoid those times that are really very hot, when nobody can learn anything because of the heat, and then they are at risk. Also, the data is another problem. Also, when you need to do those things, you need really to have actual data from the Met Service as well as for the health department. So those are the challenges. So we are very grateful for this collaboration to build it. It was not easy having all those departments to work together, but through the experience, I have to say, we start in 2019, our first workshop. So all those time we are trying to build understanding between us and the health community, and we come up with this. Now we are trying to upscale it, and now we have the Ministry of Health. We are really hearing and want us to upscale it at the national level, where we can send those messages to people so they can better prepare for health. Thanks very much.
Thank you so much, Ousmane, for sharing that sort of pioneering national example of managing extreme heat, a health burden that many of us are increasingly feeling around the world. I'd next like to pass it to someone equally committed to extreme heat, who's often in the hot seat of bridging the Met and the health community. It's Dr. Joy Shumake, lead of the WHO-WMO Joint Climate and Health Office, who we're lucky to have with us today to provide an overview of sort of a global state of play. Joy is the leading focal point for climate services for health at WMO and directs the 10-year-old joint WHO-WMO office. She's also the lead coordinator for Global Heat Health Information Network, GHIN, and is intimately familiar with some of the challenges Ousmane and his team are tackling, leading a response to the global call to heat action by UN Secretary General Antonio Guterres. And Joy is an environmental health scientist and public health practitioner and has supported work to advance multilateral coordination and alignment between the WHO, WMO, UNICEF, and other actors, and has almost single-handedly been holding down the fort at the Joint Office over the last decade. She is a pioneer that has been waving the flag for climate information services for health system strengthening since its very earliest days. And we're lucky to have her with us today to share the current state of play. Thanks so much, Joy, for being here. Over to you.
Thank you, Barbara. And a huge thanks to USAID and the CASA team for the resources that you all have put together. These are an invaluable and very consistent resource now available to the field. So please go ahead and advance. So as Barbara's already mentioned, the World Health Organization and the World Meteorological Organization have been working together for quite a long time because it is so obvious why climate and weather information should be available and used by the health community for decision making. And so when we talk about WHO and WMO, also remember we're talking about the public health agencies, the CDCs of the world, the ministries of health, and the National Meteorological Services. So we have been working together to build the field of climate services for health quite intensively for well over 10 years now. And last year, we took a deep dive and looked at the state of climate services for health. So on the next slide, this report came out last November, and it was really a pulse on the field. And what we saw is that there is a tsunami of demand, that health is now recognizing the severity and magnitude of the climate risks and starting to incorporate very strong policies to address climate risks. But at the same time, we also see that they are not adequately accessing and using climate information to inform these policies and programmatic activities that we've heard about. And so the real next challenge is realizing the potential of climate services. So this work is very instrumental in moving the field forward. So next slide. Some of the things that we found in this report is that when we ask meteorological services, are they working with the health community? 74% say yes, we are, and we're providing climate data to the health sector. But then when we look at the utilization, how many ministries of health are actually using this information in a systematic and regular way to make decisions? We see less than a quarter of ministries of health have a surveillance system using climate and weather information. We see that only half of countries have conducted climate risk and vulnerability assessments. And when it comes to heat warning systems like the one that Ousmane has just described in Senegal, only 19% of low and middle income countries have such services. So there is a long way to go to prepare the health community for climate risks. And part of this in this last box at the bottom is that we see that there is a huge capacity gap. Only about 30% of national Met services are really prepared to work with the health community hand in hand in the way that we see Ousmane and the Senegal Met Service leading the way for co-production and cooperation with the health community. So this is a big trigger to us that we need to do much more. Next slide, please. So when we ask the Met Services what is their level of maturity in working with the health community, you can see they're mostly telling us that they're getting to know health partners and understand their needs, but they're not moving over to the end of the spectrum, that 6 of having full co-production cooperation with the health community. And so that is where we want to go. This is the needle that we want to move in developing the experience and the applications in climate services. Next slide, please. What we see as the state of climate services is that there's a tremendous amount of progress that's been made through research and pilot projects, some of which are in the case studies of this project. And these are really demonstrating the value, how having information, having early warnings can change systematic and programmatic decisions that make a difference. They make a difference to people's lives, they make a difference to budgets and the impact that health sector programming can have. But in order to use this information in a more systematic and regularized way, there are a large number of institutional barriers that we need to surmount to really bring climate services to its full potential. Next slide, please. So in Geneva, the WMO and WHO have been working with an expert team over the last 4 years to figure out what is this strategy? What is the long-term strategy to address some of these systematic gaps that will move the field forward and really prepare the health community to address climate risks? So we have a new 10-year strategy that we are just kicking off. So next slide. Is that this strategy is addressing a series of fundamental gaps. And the gap analysis is available both in the 2023 State of Climate Services report and also this policy synthesis document that may be interesting to some of you. But these are the 4 gap areas that we have to work on simultaneously to really build up the expertise of both the meteorological services, our partners, and health practitioners and policymakers. Next slide. To give you a little sense of what this strategy looks like, we are focused on 4 grand challenge areas on the left-hand side, starting with understanding urban health risks, particularly extreme heat and air quality and extreme weather risks to urban populations. We're also looking at infectious disease risks, climate and nutrition, and then what are the integrated adaptation and mitigation actions which also require climate information and services. We'll be implementing this strategy at 4 levels, from global to local, and really focused on key activities in what we're calling the foundational areas on the right-hand side. So the next slide is just highlighting a few of the things that we will be launching in the next year with new support from Welcome. Particularly looking at that capacity building through training, through focal points for health at the meteorological services, through end-to-end pilot projects and service capabilities. So we look forward to collaborating with all of you as we're working collectively to build up the application and use of climate information and knowledge for climate resilience. So thank you very much, everyone.
Thanks so much, Joy. Thanks for providing that valuable bird's eye view on new horizons in the field and some of the exciting momentum, and touching on both some of the challenges and the opportunities of where we are today. I'd love to pass the baton over to Kathy, who's going to, I think, moderate and facilitate us in some Q&As. Over to you, Kathy.
Great. Thanks so much to Barbara and to all of the speakers for doing such a wonderful job presenting this material and sharing your perspective. Yeah, I've really enjoyed it. I know these materials very well and all of your work, and I've still really enjoyed your presentation. So thanks so much. We do have quite a few questions in the chat. Unfortunately, we don't have a ton of time. So we are now having our panelists try to answer a lot of things in the chat, but we're also going to take time for 1 or 2 questions. I wanted to talk about, first, I thought we might talk about kind of how to get started on climate and health work. So there's several questions directed to Ousmane about how, kind of what are the first steps? Are there any, to get started in this heat work, what kind of steps could countries take if they wanted to progress in this way? So I thought that might be an interesting question, just kind of to think about how USAID could move forward in this work. So maybe we could go with that, if that's okay, Ousmane, if you're out there and you could talk a little bit about how this happened.
Sure. Quickly, of course, I mean, many met services are forecasting temperature, but it's different from a heat wave. So the first question is to try to define what heat waves mean with the health community. Once you have a good understanding now, you can try to look at in your forecast whenever you cross a threshold. Let's say it's a 95 percentile. I mean, it's technical, but the Met Service understand what I meant. You can start defining the heat wave. And now ask the other question, what does it mean for health people? So there you need now to start engaging with the health community at the beginning. And also don't forget that you need also as well social community, because vulnerability is very important. And when you start now as technicians thinking about this question, about the demand, about how to produce something, you need to have some kind of validation. And when you pass now that step, that's where now you need to outreach the community. First in Senegal, we started with just the health community, ensure that all those practitioners in the hospital are getting the bulletin. And after a season of heat wave, make an evaluation. So we call them and make evaluation. What did they do? What they see it? Is the threshold was right, or what we need to change? And then you start now changing it and start to tailor it into the need of the population. I think that's a key step to do. After now, of course, you need funding, because training is very important. You need to train people. So that's why maybe USAID and others as a component are important to do. Also, don't forget, also you need the government somehow to be involved, because most of the planning are done by the government, and we want to ensure that all those early warning or those projections in the long term are included in the government planning.
Okay, thanks so much for that, Ousmane. I think Ousmane brought up a lot of good points, both about kind of how to get the agreement and how to work together, but also this issue about funding and financing. So I wanted to go to another question that was around how to access climate finance, how we see this field evolving in the next few years, and the role that USAID will play. So we do have quite a few folks from USAID on the line, and I also wanted to take a moment to also introduce Fernanda Zermoglio and Maggie Barnes, who have helped with this effort, in case they want to take this question. So Fernanda is a senior advisor at the Center for Resilience at USAID's Bureau for Resilience, Environment, and Food Security, and she led this work. And Maggie Barnes is the Program and Comms Coordinator at USAID's Office of Health Systems. So between Fernanda, Maggie, Kristen, and I wanted to ask a little bit about how USAID sees the landscape of climate finance for climate information services and health system strengthening evolving, and the role that USAID will play in this in that landscape. I'm not sure if there's someone, if one of you are able to speak to that.
I wanted to just check, Kathy, whether maybe Fernando wants to go first. I'm happy to provide a few comments on that.
Go ahead, Maya. Go ahead, Maya. I will follow you.
Sorry. Okay, there we go. So I just actually wanted to say, you know, we are moving so fast in this space of climate and health. And one of the things that we need to recognize is that when we first actually started speaking about climate change and adaptation and mitigation at USAID, health was not a big part of the conversation. But through some really excellent conversations across our bureaus, we've developed those working relationships, those programming relationships, and I certainly foresee that this is an area that we want to and will continue to work together on to grow at USAID. I also maybe will just say really quickly, across USAID, as well as our other partners, our multilateral partners, there's a sincere recognition that this is an area that needs greater investment. And one thing that we can all focus on is really that continued advocacy, that evidence generation, and I think alignment on priorities, because the needs are great. So as we leverage our resources and as we focus, is that we keep working together to align those investments where they are most needed. And this link of information systems to health systems is a critical bridge that we need to build. Fernando, with that, over to you. Thank you.
Thanks so much, Maya, for those excellent introductory words. I think it's really important to take a step back and say how thrilled I am to see this work coming to fruition. It's been very much a labor of love for Barbara and her team, and I just want to thank everyone who has been shepherding this along. As Barbara said, really the ground is very much shifting actively under our feet. But a couple of years ago, we did take some stock on the available finance landscape for climate and health investments. And I'll have Hannah put in a link in the chat to everyone showing a tool that we developed. Probably the best approach moving forward as we sort of continue to better understand both the opportunities that USAID programs have to lean more into the climate and health space, but also broadly how the global landscape is changing, is to look at a series of potential entry points. One from helping countries better develop the evidence base and proposals to larger multinational funds such as the Green Climate Fund, et cetera. That's something that certainly that USAID can do, but something that WMO and WHO have actively been doing in the space of the Global Framework for Climate Services. The second piece of the puzzle, which I think is really illustrated in the case studies that we developed, was we oftentimes need to make the case for why proactive adaptation and proactive risk assessments are super important for our global health programs. So we are currently in the process of developing a simplified methodology to help our global health programs better align with climate risks. And I will leave it there just to say that perhaps Hannah and others could share our emails in the chat since I know that we have to close, but I'm happy to continue the discussion with others. Over.
Okay, thanks so much for that, Fernanda. Yes, unfortunately, we don't have a ton of time yet left, which is a real shame because we are excited to talk about these materials and the work that has happened. So please do reach out. I do have, as you have seen, we have a panel of experts on this, and they are furiously typing answers to your questions in the chat. We're going to try to make other opportunities, so feel free to reach out if you have questions or want to chat more about this. With that, I'm going to pass it to Kristen Patterson for some closing remarks.
Thanks, Kathy, and thanks everyone. This has just been really a fascinating webinar today, and thanks everyone for their time. And I really want to just emphasize what Joy shared, about how we really need to seize opportunities to tap into the potential to apply climate knowledges and services in the health sector, particularly in partnership with folks like Ousmane who work with national meteorological and hydrological services, as well as ministries of health, of course, who use the data, and other collaborators. And at USAID, our Global Health Bureau does have a climate action plan, and we have 3 objectives for that plan. which really focus on awareness, so early warning systems, mitigation, as well as adaptation. And we know that work on extreme heat that Ousmane talked about is so essential. We know that close to 1 billion people in low and middle income countries are served by healthcare facilities that have unreliable or no electricity access, which implies that they also have no access to cooling or fans when receiving treatment for things like extreme heat. So we need to address that as well, all of which underscore how important, climate-informed weather forecasts are for responding to things like extreme heat. So we can and we must do more. Advances are being made, and we have new and enhanced tools that are emerging, as well as lessons that we have all been learning regarding integrating climate and health surveillance systems. And our speakers today really shared concrete ways that we can use climate information services to support climate adaptation and strengthen health systems in the face of climate impacts. So I just want to say thank you to Kathy, Mai, Barbara, Ousmane, and Joy for sharing your time and knowledge so generously with us, and we appreciate you. And then to download future information and updates that USAID shares, I think Hannah has just put that link in the chat, so keep an eye on that link for more information. And while we know that barriers remain, the time is now to transition from pilot projects to really cover entire countries with around-the-clock support systems that inform and enhance health systems resilience. And we look forward to continued collaboration with you all. Thank you.
Great. Well, thanks so much, Kristen, and to everyone else. The CASA team really appreciates all of the work that you have put into this. And we also really appreciate those of you who turned up today to listen and to ask your questions. And we look forward to working together in the future. So thanks so much. Have a good day.
Thank you all.